The Patient's Charter of Rights and Obligations lists what patients can expect from the Public Health Service in Trinidad and Tobago. It is a document that we are obliged to follow, but do we really know what it says, and do we understand what it means? This talk will explore the Patient's Charter as it pertains to the emergency and pre-hospital setting. So we'll start with a case. A 78-year-old patient is brought to the emergency department by his family. He's having shortness of breath and chest pain, but is stable and seems alert and oriented. The patient says he wants to go home and does not want treatment. He asks for a second opinion from his private cardiologist. He claims that nobody has told him anything. The patient's neighbor takes you aside and demands to know what is going on. So, in the light of this case, let's think about what the rights and obligations of the physician and the patient are. At the end of this session, you should be able to list the main components of the Patient's Charter, discuss specific components pertinent to emergency medicine and pre-hospital care, and discuss the implications to our clinical practice. We're going to talk a lot about the Charter, and it can't fit onto these slides, so you can click on the link or copy and paste it and open that while we continue this presentation. You might want to just pause the presentation and open up the Patient's Charter in a different window. So these are the 19 patients' rights, very much condensed. And as I said, we're not going to try to talk about all of these. We're going to look at the highlighted ones in respect of the case that we're discussing. But remember, apart from their rights, patients also have these 6 obligations. And again, we're not going to try to cover all of these. We're just going to look really at the first 3, although we touch on others. So let's start by this thing about the patient claiming nobody has told him anything. What are patients' rights? Patients have an expectation that they will have impartial access to treatment, and I put this here because remember, when patients start talking about we don't know and nobody's telling us anything, there are 2 sides to this. One is we must not let that influence the way we approach a patient. But the other is impartial access requires appropriate information, and patients have a right to receive that information from the professional responsible for coordination of their care. And they need to know who this is. So you need to tell your patients your name and your position in the organization. You also have a right to receive respectful treatment from providers of healthcare at all times and under all circumstances. On the flip side of this, the patient has certain obligations. The most important with regard to this particular situation is the obligation to supply accurate and precise and complete information about themselves. So in a situation like this, we can assess the patient appropriately and provide the level of information that is appropriate and necessary. So what about the patient saying he wants to go home and does not want treatment? Again, remember that any treatment provided to a patient must be done so with the patient's consent and participation in the planning of healthcare. Of course, this includes the right to refuse treatment. On the flip side, patients are required to comply with the instructions they are given. And if they do refuse treatment, then they have to understand that they are responsible for their actions and any consequences. This does provide a conflict, actually. However, we still require patients to be compliant, and if they are refusing treatment, then we have to come to some compromise about how we care for them, and they have to come to some compromise about what they're willing to do and how they're willing to participate in their care. The patient asks for a second opinion from his private doctor. This does create problems in the public service. However, the patient's charter itself is quite clear about this. You can ask for a second opinion, but if it's not being provided by the public service, you have to stand the expense. Remember that in this situation, patients do have a right to communicate with others outside of the hospital personnel. So we can't prevent patients from getting second opinions in that situation, although it has to be a controlled action. We also have a right, the patient also has a right to continuity of care within the institution. So even when patients start refusing care, once they are still with us, we have some obligation to them. But I would suggest they also have a right to continuity of care beyond the institution, and we need to liaise with people who might be providing continuing care in this situation. And finally, let's fit in here freedom from abuse, because sometimes when patients are not compliant, or when we find them to be difficult, we can actually cause them mental and emotional distress, and we have to be careful to avoid this. The patient's obligations here is to respect and be considerate of the rights of both other patients and personnel. So while patients may refuse treatment, they're not allowed to be abusive towards staff or disrupt the care of other patients in the process. Finally, what about the patient's neighbor demanding to know what is going on here? Well, patients have a right to privacy, and therefore sharing their information with others without their consent is not appropriate. However, in some situations, we will take the responsibility to notify family members or make every effort to do so, particularly in a patient who is unconscious or comatose. When we're thinking about patients participating in the planning of their treatment, that is another situation in which the patient does have some rights to include a family member in things like formal case conferences. So if you're going to talk to a patient about their care plan, you should be willing and prepared to include family members at the request of the patient. In the context of sharing information and planning care, and in refusing care or involving relatives, it's important to remember that patients are responsible for observing hospital regulations and statutes that relate to treatment and behavior, and are responsible for being considerate of the rights of other patients and personnel. If you have any questions or comments, you can post these on the discussion board on the website. And in summary, I'll leave you with a quote from the Ministry of Health website regarding the Charter of Rights. As I said before, you can use this link to look at a more complete document of the Patient's Charter of Rights and Obligations.